We're going to have an interview and then a panel discussion from our speakers of the session. So I'm going to call up here Mrs. Sandra Murphy and her husband, Darren Smith. And I've had the pleasure of getting to know both Mrs. Murphy and Mr. Smith for the past 6 to 7 years is when we met, because I reviewed our first encounter and our encounter since that time. So please join me up here. There was a great poster Yeah. There you go. I'll get this one. Okay. And just have a seat and be comfortable. And so there was a great poster yesterday that looked at senior medical student knowledge from South America about FH, and it was not surprisingly poor. In our medical school at Emory, we have had, as part of our cardiovascular module for the first-year students, for 20 years now, we have had a session called Clinical Correlates in Lipids and Atherosclerosis, where we start out with a geneticist. So we start out with a biochemist, followed by a geneticist, followed by a clinician, a preventive cardiologist myself. But the most important part of that class that we've taught for 20 years is we always bring a patient living with FH or an individual living with FH. And I frequently bring an individual who's vibrant and really could just be the students in the audience sometimes, or their parents or their family. And so Mrs. Smith and her husband represent vibrant, amazing individuals that I've had the opportunity and honor to get to know. And what I thought we could start out with is just tell a little bit about your story living with FH and your family's story.
Okay, well, I grew up in Boston, as you know, and vibrant. Thank you for that word. That's beautiful description. But I grew up in Boston, and I always thought I was pretty healthy. You know, I was a lot smaller a lot of years ago. I grew up, I married, had children, went to school, everything up there. And I hadn't heard anything about cholesterol until after I had a blood transfusion, probably like 19, blah, blah. We won't say how old I am. But
we'll keep that confidential.
Yes, you know. But anyway, I had a blood transfusion, and afterwards they told me I had high cholesterol. And like I said, I always thought that was something that other people had to worry about, that like, I thought it was I hate to say it like this, but I thought it was something for fat people. Yeah. Because that's the misinformation you get, you know.
Do you remember how high your cholesterol was when you were first told it was high, or just that it was high?
It was, when they initially told me it was, they didn't give me a number. They just said it was high. I had elevated cholesterol. But I thought I could do something about it myself. I just went to the gym every day. I worked out. I changed the way that I ate. You know, I did those things. And then, let me see. I think it was a couple of years after that, I developed lumps on my Achilles tendons. And I went to see an orthopedist who told me that the lumps on my Achilles tendons were pump bumps.
Okay.
From wearing high heels. All I had to do to get rid of these bumps was to stop wearing high heels, and I was going to be okay. Real interesting. But a couple of years later, my 2-year-old, I had a son who was 2, they told me his cholesterol was elevated, and his was over 400. So I took him to see a doctor, and when I went to see the doctor with him, they asked if he had any lumps on his body, and I asked him, so you mean like this? And I showed him my Achilles. They said, that's cholesterol. Kind of blew me away. So my son, when I asked them about medication for him, he didn't have any lumps yet, thank God, but when I asked them about medication for him, they said there were no studies that backed up, you know, a change in outcome for giving a child medication at that time. And that was kind of like 30 years ago, so it's like 32.
About what age did you start taking medications? And I know both in Boston and in Atlanta, you had some challenges with some of we talked about statin adherence a minute ago, and I counted up that you had tried 5 statins before, you know, meeting me, and niacin and cholesterol and colesevelam. So you had tried the litany of medications, yeah.
Well, every time I tried a statin, I would find that it made my body hurt. it just didn't make me feel well. They didn't agree with me. So the first doctor tried several, and then she said she'd give me a break, and then that's when I moved here. And the doctors that I saw here, well, I didn't see anybody at first, saying I didn't have any insurance, so I didn't go to the doctor much.
Yeah.
You don't go unless you have a problem when you don't have insurance, so I didn't. But when I think after living here for about 9 years, I had a heart attack. I didn't realize I was getting sicker. I didn't even think about it. I felt fine. So I had a heart attack, and then they told me I had blocked arteries. I had 3, and I needed to have a CABG done. Yeah. I needed 3 arteries grafted, but they could only graft 1 because the other 2 were too small. So after that surgery, I began the routine of coming in every couple of months and having cardiac caths done, because I started having blockages every couple of months.
And I counted up on the chart from Mrs. Murphy, at least in Atlanta, she's had 18 heart catheterizations because, we'll talk a little bit about each time you come into the emergency room, the team there usually presses the panic button.
Yeah.
Not usually on your side, but it leads to an escalation of steps. And I did want to, so you told us about your history, your sons. When was the first time you heard the word familial hypercholesterolemia? To you and your husband, when was the first time somebody ever even said this is a genetic problem and this is a problem that needs, not only care of you, but your extended family?
Frankly, it wasn't until much after the CABG.
And the bypass was about 10 years ago.
10 years ago.
Yes.
So after the bypass.
Certainly.
Yeah.
All right. Yeah. And then you have, and we'll talk a little bit about the unique treatments that we've been focused on to do everything we can to keep you away from us heart doctors, but you've been treated with the LDL apheresis since 2013 and started on a PCSK9 inhibitor, the injectable medicine, fairly soon after it was FDA approved, so really within a month. And one of the things we talked about is, I do want to hear about your experiences with these therapies, but just our office has developed very much a team approach with individuals living with FH, and the center of that team related to approval of medications, troubleshooting questions and concerns, and then even related to our patients who are being treated with LDL apheresis. And so maybe if you can comment about the team that you've established with over the last 6 or 7 years versus the challenges and adventures you had, from the initial high cholesterol up until, a few years back. Yeah.
Dr. Sperling works with amazing people. Everybody that works with him gives 100%. The nurses, the other clinicians, they don't take no for an answer. So a lot of times a medication won't be an approved thing with my insurance, and they keep pushing. We write letters of medical necessity. They do whatever is necessary to make sure that anything that's needed, I get. So they said no to the PCSK9 inhibitors.
And an important part of the process for us is that team approach, but not only an appeal from the office and the clinicians, but we found that an appeal from those living with FH or those at high risk can be more powerful than the one coming from our office. So we try to send those simultaneous appeals.
Yeah.
Just how about impact on your family, Mr. Smith,
Wow.
in terms of, your wife, but also the extended family. You have had 4 biologic children, a son with high cholesterol, and we've talked about him multiple times. But as a husband, as a father,
I've learned more, unfortunately, about cardiac and the heart than I ever wanted to know. I'm more accustomed to looking at a room full of lawyers than looking at a room full of cardiologists.
that's because he is a lawyer, right?
But it's very different. But and having now read all this about cardiology and FH, hypercholesterolemia. Sandra and I are now caring for our 5 grandchildren, 5 of our grandchildren, shall I say. We had a daughter to pass of multiple, what did she have?
Cardiomyopathy.
Cardiomyopathy.
Cardiomyopathy. See, I'm learning to say your words and everything. In any event, she died suddenly, and we have taken in her 5 children. And at 60 years old, it's not fun raising 5.
He's 60, I'm not.
Raising 5 children, 5 small ones, it isn't easy. But to watch Superwoman do what she does with FH, with Dr. Sperling's help, it's amazing. We were introduced to Dr. Sperling by another interventional cardiologist, Dr. Flynn, who was subsequently moved on. But it's been as Trump would say, an amazing journey. But I mean it. I mean it when I say amazing.
How about advice you can give to, we have experts from around the world here. We have other individuals living with FH. We have champions of FH and people that are really trying to move the bar in terms of evaluation.
Education.
And education.
Education, period, education. So many folk are unaware, as was I, until it impacted my life. But for just the roll of the die, if you will, having run into you or our paths having crossed, it's still possible because given some of the folk that we've met, Sandra having had 18 stents, or at least 18 catheterizations, that is, you can imagine how many times we've been to the emergency room in pain. We lived there, used to, till we met Sperling.
Another thing that I think I've been very impressed with related to Mrs. Murphy is we focused this meeting on FH and cholesterol, but importantly, other cardiovascular risk factors, both traditional, non-traditional, magnified cardiovascular risk. And so you've successfully quit smoking.
Yes.
5 years ago? I don't know.
6.
6 years ago.
6
Okay,
years
I'm giving you more credit. Yeah, your blood pressure is well controlled, and then there's a family history of diabetes too. And so you carry the genes for diabetes, and you've really focused on diet and really staved off the diabetes. And so all of these have additive, powerful impact on keeping you healthy and hopefully many more years to come. So we really appreciate both of you spending this time with us here and providing us with advice and words of wisdom. And what I'd like to do is call up our other speakers for a brief panel discussion. And Dan and Josh, you can tell me about how long we have for 5 minutes. Okay, so maybe if the other speakers from the session 5 can join here. For the time we have remaining before the break, I wanted to see if there were maybe questions or for Fatima, Laura, for Mrs. Murphy and Mr. Smith, any questions you have. And then if there are questions from those in our audience for any of the speakers related to this last session, please come up to the mic, and we'd like to hear your questions. We'll take several questions, and then it'll be time for a break. So I don't know if Laura or Tima, you have a question or a comment just after hearing the story from Mrs. Murphy and her husband. Oh, you have no mic?
No, I said we have people.
Oh, okay. So, okay, we'll take the mic then, questions first. So go ahead, please.
My name is Chima Wizu. I'm a physician from Colorado. Thank you very much for the great presentations. Ms. Murphy, can you tell us your experience with getting health insurance?
There are a couple of good hospitals here, and the doctors help you get insurance. So I got I had to get sick to get insurance, sadly enough.
Yeah.
It wasn't until after I got sick that the hospitals were able to help me apply for insurance. Oops.
Any experience with commercial insurance?
Not here in Georgia, no.
Next question, please.
Hi, I'm Annette Baker. I'm a nurse practitioner in Boston Children's Hospital lipid program. I'm just really fascinated by the fact that you got diagnosed after your son with his diagnosis. And I guess my question is, what was his treatment? I don't know how old he was when he was diagnosed, and what age did he start statins, or is he on statins?
The funny part is he was diagnosed at Children's Hospital
He was.
in Boston.
In Boston?
Yeah, yes.
Oh, so maybe I've met you.
Yeah.
I've been there a long time.
As I said, we won't talk about how long. No. It was about 30 years ago.
So I've been there for 30. But
Wow.
at that time, we didn't use statins on little children. So what age did he start, or has he started?
Unfortunately, my son will not take medication. From the time that he was diagnosed, when he didn't get medication, when he was told that medication wouldn't help him, he has it in his head that medication won't do anything for him. So he believes that he can control it by diet and exercise. He does see doctors, but he won't take it.
And at his age,
30.
we can only remain hopeful.
Yeah, we talk about Mrs. Smith, Miss Murphy and Mr. Smith's son every visit. I always ask about the son and
And he's here,
and
local.
ask him to come in for a visit. So that still stands.
Wow, okay. Thanks.
Is he at the meeting? We're all happy to talk with him.
We
That would be
invited him.
Great, we did invite him. And he promises to come.
So I guess to the two questions, then we'll break. That'll give us.
Say, take that.
Say, T, come. Yeah.
I'm going to hold you to that.
We'll do it.
I'm Zahid Ahmed from UT Southwestern Medical Center in Dallas. So Dr. Sperling showed data from Cascade Registry that African Americans or blacks and Asians are not treated as aggressively as whites. I was wondering, and also women are not treated as aggressively as men. Right. I was wondering, Ms. Murphy, if you had insight onto what the barriers might be, or discrimination might be part of it, or it may be hard to tell because you may not be able to compare to other people, but I was just wondering if you had any particular insight.
I know I've met a lot of people. I've met a lot of women in my community who had not heard anything about FH prior to me talking about it. This port that I have to do the LDL apheresis is a great conversation starter. And so they always ask, why do I have it? And it's high cholesterol.
Right.
And then I meet people with high cholesterol all the time, but a lot of them never heard of FH, just high cholesterol.
So it starts the conversation.
Yeah.
It does.
Yeah, and I do research in this area, and I think a lot of it is there's an underestimation of risk, particularly for women often. And then, but there's these available opportunities. Sometimes it's when patients are pregnant and they're getting obstetrics care, or when they're caring for their children. Yeah. Those are kind of unique opportunities to intervene and screen.
And those gaps in care. Yep. So John and Sarah, and then we'll time for a break, it sounds like.
John Guyton from Duke, and I had the pleasure of just happening to sit down with Darren and Sandra at lunch today, and I just want to thank you for bringing your story and sharing your life and inspiring. This is what it's all about, really.
Thank you.
And I have this is a technical comment, not technical, but theoretical comment about statin intolerance. The Oxford group has done the meta-analysis of statin intolerance along with Jonathan Tolbert and Connie Newman, who are well known in the U.S. for bringing this story ahead. And the answer from that is that the biologic occurrence of statin intolerance is less than 1%. The technical part about that is the question of whether they're treating statin intolerance as either happens or doesn't happen. That is a 0 or 1.
Yeah.
If in fact, and I'm kind of speaking to the thought leaders here, if in fact statins might make ordinary aches and pains a little better, then that's all out the window. And you don't have, so if there's a -1 in there for some people, that's all out the window. It just, for most of us who treat patients with hypercholesterolemia and hear these stories, these repeated stories, we tend to think that it's not less than 1%, that it's more like 3 to 5%, perhaps. And the other technical comment about that is, with regard to statin intolerance, the best evidence is not a meta-analysis of randomized controlled trials. The best evidence, theoretically, and if you look at the people, the gurus of evidence-based medicine, the best evidence is an aggregate of N-of-1 trials. And that's what we really need to do. That's something that we really need to be thinking about and doing in this area of statin intolerance. I also was just reading a case, one of my recent patients who had trouble taking Praluent, and of course I don't think he really had a bad headache for 2 days after taking Praluent and would not take it again. And I said, "Gosh, we need a placebo pin."
I'm going to make a brief comment, and
Sorry.
then Sarah, then we'll take a break. But having written the section in the 2018 cholesterol guidelines on statin safety and statin-associated side effects, and along the lines of Fatima's excellent presentation on the problems related to adherence, in the guidelines it says we no longer favor utilization of the term statin intolerance. First of all, we're not even sure what that means. There are clearly statin-associated side effects and statin-associated muscle symptoms, but many who are branded as statin intolerant that's on the chart, and we know when we try to, we kind of just look past that without trying to reinitiate statins, other doses, and so I think we need to move away from statin intolerance and really go into, there clearly are going to be needs for those who have had statin-associated side effects and statin-associated muscle symptoms. So, Sarah, last question, break time.
I'm struck by your story about what your son heard at the age of 4 or thereafter, also in Boston, and I think it just reminds us we have to be so careful about the way we talk about medications and about FH. We have another family with 2 kids who have homozygous FH and, of course, 1 heterozygous, and we lost contact with the person who has heterozygous FH, the same situation. So I think we as providers just have to be very careful about how we talk about medications, about safety in the ears of our younger patients and our older patients. And thanks for sharing that.
So we thank our speakers and our invited guests. And with that, I don't know if the announcement, Josh.
Yeah, so that presentation was so worthy of that. That was an amazing thing. I think we should thank you, with applause.